a cohete. A todos nos corres, abuelita. Aquí estoy, mi reina. Aquí estoy. Orando, Señor. Ay, Señor.
Hello everyone, good day. My name is Rafi and I am here with my partner, Ms. Roxanne Villaseñor. And together we will be presenting our analysis of case study that revolves around one of the most significant global health crises in the recent history. The case study that we have chosen to analyze is focusing on the outbreak of coronavirus disease, more commonly known as COVID-19. This virus first emerged in the late 2019 and rapidly spread across the globe, leading to a worldwide pandemic. Although the most severe impacts of pandemic have gradually lessened over time and many countries have started to recover, the effects of COVID-19 are still felt today, though they are now significantly reduced compared to the peak of pandemic. The emergence of the coronavirus disease 2019 marked as a global defining health emergency crisis of 21st century characterized by a rapid transmission, extensive mortality, and significant social-economic disruptions. It is caused by the novel severe acute respiratory syndrome coronavirus 2, or known as SARS-CoV-2. The disease was first identified in Wuhan, China in December 2019 and it quickly escalated into a global pandemic by March 2020 as declared by the World Health Organization. SARS-CoV-2 is an enveloped single-stranded RNA virus that belongs to the Coronaviridae family, known to infect the human respiratory system. It has an ability to bind with high affinity to the angiotensin-converting enzyme 2, a kind of receptors in human cells that facilitate efficient viral entry and replication. The virus primarily spread through respiratory droplets, aerosols expelled during coughing, sneezing, or speaking, with also evidence suggesting potential for four-mite transmission but with lesser extent. Infected individuals may be asymptomatic, mildly symptomatic, or develop severe illness. Common symptoms include fever, cough, fatigue, anosmia, and myalgia. Severe cases often present with pneumonia, acute respiratory distress syndrome, multi-organ failure, and death, especially among elderly and immunocompromised. COVID-19's burden on global health system was immense, with hospitals overwhelmed, frontline workers stretched to exhaustion, and essential services being interrupted. Vulnerable population, including elderly, people with underlying conditions, and those in overcrowded or low-resource setting face a disproportionate risk of infection and death. A multitude of issues emerged as the pandemic unfolded.
Una mujer totalmente independiente.
Mami.
Le encantaba caminar, hacía bastante ejercicio.
Buceando con la abuela.
Era una mujer que se cuidaba mucho en su dieta, siempre ayudando a cuidar sus nietos, sus bisnietos, y era una mujer completamente física y mentalmente activa.
Chief among them was the virus' high transmissibility and the presence of asymptomatic carriers, which complicated the containment efforts. The initial lack of diagnostic tools and treatments hampered early mitigation, and as the virus evolved, the emergence of new variants such as Delta and Omicron posed additional challenges, including increased transmissibility and partial immune escape. Health disparities across nations further deepened the crisis, with low and middle-income countries struggling with limited access to vaccination, ventilators, and protective equipment. Moreover, misinformation and vaccine hesitancy severely undermined public health efforts. A lack of global coordination and preparedness contributed to fragmented responses and delayed interventions. In response, governments and health agencies implemented a wide range of strategies to curb the spread of the virus. Diagnostic approaches include reverse transcription polymerase chain reaction, RT-PCR test, rapid antigen test, and serological assays for antibodies. Treatment evolved from supportive care to more targeted therapies such as antiviral agents like remdesivir, corticosteroids like dexamethasone, and the monoclonal antibodies for high-risk groups. Mass vaccination campaigns were launched globally following the emergency approval of the mRNA-based and viral vector vaccines. Preventive measures such as social distancing, mask mandates, lockdowns, and contact tracing played a critical role in reducing the transmission. However, the unequal distribution of resources and inconsistent adherence to the public health measures limited the overall effectiveness of these strategies. To enhance global preparedness and ensure a more effective pandemic response, evidence-based solutions must be addressed the underlying structural and systematic issues. Strengthening global disease surveillance and genomic sequencing capacities would enable the early detection of variants and facilitate more adaptive strategies. Investing in healthcare infrastructure, particularly in low and middle income countries, by expanding ICU capacity, securing medical supply chains, and training healthcare workers is essential for resilience. Equitable to access to vaccines and treatments must be prioritized through international cooperation and mechanisms like COVAX, while also promoting local vaccine production. Public health communication strategies should be strengthened to combat misinformation and improve community engagement. Furthermore, formalizing international legal frameworks through global health treaties can ensure accountability, data sharing, and coordinated action in future health emergency.
Todos por ti.
Madre hermosa, acá estamos todos, mamá, explicándole a Dios.
¿Cuánto daría por estar allá? Poderte abrazar, poderte besar y decirte cuánto te amo.
Abuelita hermosa, mira tu amorcito aquí dormido. Lo tengo en mis brazos dormidito, como te encantaba verlo dormir, abuela.
The spread of COVID-19 was mainly due to lack of knowledge about the virus at first. It was managed efficiently in China as they were able to react with immediate countermeasures and isolate patients who have symptoms and are infected or contracted the disease. Cases of COVID-19 from January 2020 to March 2020 were noticeably rapidly declining in China, owing it to their immediate countermeasures such as their immediate lockdown of Wuhan City. However, related cases from outside the country were noticeably increasing in numbers as coronavirus spread around the globe. The most affected countries include Russia, India, America, and other European countries. On the other hand, countries including New Zealand, South Korea, Germany, Hong Kong, and others, fatality were comparatively low. It is due to the nation's early detection and high level of testing as their preventive precautions to limit the spread of the disease. Coronavirus has reportedly confirmed billions of deaths. As you can see here in the table, from the World Health Organization record of deaths due to coronavirus, the number of mortality rate significantly rises from December 2019 to January 2021 at its peaks globally. The spread of the coronavirus was mainly due to the delayed responses of the government nationwide, considering the dilemma on public healthcare and medical system. Considering the widespread disease, healthcare facilities could not take in more patients, as there are shortcomings in the preparedness of medical systems, lack of equipment and tools, especially in the underdeveloped countries. The severity of coronavirus may vary. There are those asymptomatic to mild symptomatic illness and life-threatening, such as pneumonia and/or multi-organ dysfunction. Early diagnosis of coronavirus and treatment may lessen the severeness of the disease. We have here the nasopharyngeal swabs or the RT-PCR tests that are advocated for early detection of the antigen or the disease. The impact of COVID-19 has led to dramatic loss of human life, challenges in public health, and their livelihoods. The entire food system and livelihood was also affected due to the restriction of trades and confinement measurements have been preventing the farmers from accessing the local markets. Disruption in the selling and producing food supply chain has affected the healthy, safe, and diverse diets of the people. Disruption in the selling and producing food supply chain has affected millions of workers, farmers, and self-employed have suffered challenges such as the lack of safety and labor protection, poverty, and malnutrition. It took some time for the researchers and scientists to create a vaccine that could help prevent the severity of the disease. The vaccines such as Moderna, Pfizer, Novavax, Johnson, and others are made available to the public. Every human being is advised to be vaccinated to achieve herd immunity. The World Health Organization declared COVID-19 as an international emergency concern. Not only in the field of health, it has also affected the lifestyles and livelihoods of approximately 213 countries. Early detection of pathogenic diseases helps us to reduce the impact of its severity and mortality rate. Delayed responses will only result in the widespread of the disease. Funding research about pathogens may help us in the future to control and manage the gap about the different types of diseases in various fields, such as basic science, clinical science, public health science, policy, and system studies.
La puedo tocar. La cara. ¿Cómo está, abuelita? Aprieta mi manito, abuelita. Soy Marcela. Esa nariz tan perfecta, esa cara tan hermosa que tienes. Eres hermosa. Mira sus uñitas, sus manitos. Llegamos de Colombia y tú me dijiste, mami, tan bueno porque ya es primavera y vamos a salir con el niño a disfrutarlo. Levántese, mi reina, ya están saliendo las flores. Levántese que ya llegó la primavera.